With financial stress comes pressure on mental health, and it's in times like these that people in the bush say access to counselling services is vital. But federal government changes to the delivery of those services have seen many close down, and their replacements are still a long way off. Nancy Notson reports.
A wetter than usual winter is over, but on Eva Luther's property, the big dry is yet to move on.
It is a little draining sometimes when I'm struggling myself.
The Luther's cattle station in northwest Queensland is about an hour from the small town of Hughenden.
We've had to take Tammy out of school because of the costs of boarding school, and now she's doing her schooling at home.
Counselling services, including door-to-door, have helped see the grazier through.
It took me a few years to realise that, yes, I do need this help and to go and ask for it.
But that service is now gone, along with many other mental health measures in drought-affected areas. Federal government funding ended in July.
To have that cut and see that cut to communities that are still in drought is quite frankly mind-boggling.
Alison Fairley's organisation was one of the providers offering targeted support to people in rural and remote areas.
They don't have services now. They don't have somebody there and to build up the community events. They don't have the referral sources, and they certainly don't have the ability for one-on-one counselling.
The federal government plans to have the primary health networks come in to commission mental health services in drought-affected areas. But the PHNs say they first have to work out exactly what those needs are, and there's concern that, and the approval process which follows, will take time.
You're looking at least 12 to 18 month turnaround.
Just when you start finding something that's working, and then it's gone. What were they thinking?
The federal government says the first year is one of transition, and services continue to be provided. There's also hope in the bush that the new arrangements will provide more certainty in the long run.
Whilst this will take time, they'll be able to really target the services where they're most needed.
And for many, that can't come too soon. Nancy Notson, ABC News, Hughenden.